I'm Dr. Anthony Nicholson, and I'm very much looking forward to presenting at the upcoming TCA Winter Conference. The aim of my 2-hour presentation is to take you on a warp speed journey to the leading edge of pain science, to take a close look at how the words you use and the physical forces that you apply can remodel a patient's brain. As a chiropractor, your day is about people. They come to you with pain in their frame and they're asking for your help. Under healthy circumstances, pain is a protective mechanism and a normal part of the human experience. But why do so many of our patients live in constant pain? What's really gone wrong and what's driving it? Much of your professional life is spent updating your knowledge and refining your own understanding of how what you do actually works. But that doesn't guarantee that a patient will understand that. And what the latest neuroscience is now telling us is that it's absolutely critical that they do. In fact, the effectiveness of what you do depends very much upon what you say first, and how you manage the first 2 consultations, especially the type of explanation that you give, has the potential to change everything. From the moment that a patient has their very first contact with your practice, there are factors that will already determine their response to any future treatment. I think we've always known this at some level, but what the research is now really showing us is the therapeutic impact of first impressions, the questions you ask, the words you use, how you examine, how you explain to the patient what's wrong with them, and what the aim of your treatment really is. Because you're not just treating a problem, you're treating a person with preconceived beliefs and ideas about their problem. And what the research now demonstrates is that how a person mentally represents what's wrong with them can determine whether they respond to your treatment or not. For a long time we've marveled at how the rapid passive movement of a joint, lasting less than 1/10 of a second, can change the behavior of the nervous system in a way that outlives the event itself. And it's now well recognized that the way in which the brain perceives the body parts and the world around us can be different after a single joint manipulation. But we should also realize that the way in which the brain perceives the body parts can be different after the right explanation. This presentation is about a process. It's about asking the right questions to uncover the faulty beliefs that you must address. It's about using words that empower the patient rather than create fear. It's about moving away from damaged parts and towards brain plasticity. Away from frustrating notions such as in or out, and towards enlightening concepts such as crisper brain maps. It's about using pain neuroscience education as best practice. It's the realization that often we need to de-educate in order to re-educate. So join me for a 2-hour online presentation that is about connecting with your patients at an entirely new level.